Welcome to our channel. Our topic is types of wound healing based on SRB manual surgery book. Let's we see the video. See types of wound healing. There are three types of wound healing: primary intention, secondary intention, tertiary intention. Primary intention, which means we are closing the wound primarily with suture material or skin graft or flap. See, basically, if we are trying to close the wound with the suture material, it should be a clean and the edges should be very proximal to approximate each other. So we will see detail in the next slide. Say secondary intention means in this case we are not closing the wound primarily. We trying to reduce the contamination and infection, then in later stage which will granulate and reepithelize itself. So this is called secondary intention. Tertiary intention means which also we are not closing the wound primarily. We will allow the contaminated wound into clean wound by wound debridement and serial wound dressings. After once the wound contamination is settled, we will close the wound with suture material or skin graft and flap cover. So these are all the three types of wound healing: primary intention, secondary intention, tertiary intention. Here at the time of wound, we are closing the wound. Here we are giving time to settle wound itself. Here after giving some time, we are closing the wound by primary intention. These are the differences. See, based on this classification, clean wound having low infective rate and dirty wound having high infective rate. So based on this wound type, we can treat these wounds by primary intention, secondary intention and tertiary intention. See what is mean by primary intention. The closure of wound at the time of full thickness wound with the suture staples, adhesive strips and surgical glue. So here the clean wound without any contamination with the edges close to each other. So we can close this wound with the primary suturing. See, after suturing the scar is very less, minimal scar is there. See, this is the patient treated with the primary intention suturing, which will lead to minimal scar. So advantage of primary intention. Primary intention, which will reduce the infection rate. The wound will be less exposed to the environment. The minimal scarring and wound will be fast healing. Then indication for primary intention. What are the indication? Clean wounds, clean contaminated wound and acute wound. Then the little tissue loss. See, the edges will be very close. Then only we can cover it with the primary intention. If it is edges will be lost, now we have to wait for granulation. If we are waiting for getting granulation, which is secondary intention, so the edges will be very close. Then only we can treat with primary intention, and it should be clean without any debris. If we have any debris or contamination, we have to wait for convert the contaminated wound into clean wound. Then only we can cover it with skin graft and flap cover like that. So primary intention means indication clean and contaminated wound and edges should be proximal to each other. Then coming to the secondary intention, which means we cannot close the wound primarily with suture material or skin graft and flap. Say we have to wait until the wound will get granulation tissue without any contamination. That granulation tissue will elevate from the base of the wound, and it will get reepithelialization, which is called secondary intention. Okay, then coming to the indication for secondary intention. If one wound is presented with very much contamination, so we have to give daily wash and debridement to get granulation tissue. Once the granulation gets, it will get reepithelialization itself. That is called secondary intention. Here we are not at all doing any suturing or skin graft. See, this is the primary intention healing, so patient will get minimal scarring. And in case of secondary intention, the after getting granulation tissue, because of epithelial reepithelialization, the wound will be much more scarring compared to the primary intention. See, what are the indications for secondary intention? Contaminated wound or dirty wound. Once the patient presented with delayed presentation more than 4 days, and once the patient with wound with edges distal to each other, so we cannot suture it primarily. This is the example. Patient with basal cell carcinoma of nose after excision, we waiting for getting granulation tissue. This is the secondary intention. After healing, there will be a scar. The tertiary intention, here also same like secondary intention, like there will be a contaminated wound and wound having infection and edema, so we have to wait for converting the contaminated wound into the clean wound. This is the example of tertiary intention. The wound with minimal slough and infection, so we have to give proper antibiotic and followed by daily dressing and wound treatment. Then only we can convert this wound into clean wound. So after converting the contaminated wound into clean wound, then we have to close it with suturing or skin graft or flap cover. In secondary intention, the wound will heal itself with granulation tissue and reepithelialization. But here, after waiting some period to convert the contaminated wound into the clean wound, then we are closing the wound with skin graft, skin flap, and skin substitute. So now we studied about primary intention, tertiary intention, secondary intention. We will see the next video about wound healing and its pathophysiology. Thank you.